Have you ever felt stuck with a patient's physical symptoms when all the tests come back normal? Yeah, it's a common and honestly a frustrating spot to be in. In this explainer, we're going to build a really practical framework to cut right through that confusion. You're going to learn how to formulate these complex cases with confidence, and just as importantly, with empathy. So, let's get in.
So here's our game plan. First, we'll cover the foundational mindset. Then, we'll deconstruct the why behind the symptoms. After that, we'll build that all-important mind-body bridge, craft the actual formulation, and finally, we'll see where diagnosis fits into the whole picture. See how each step builds on the last? It's all designed to lead us to a complete understanding.
All right, let's jump in. Section 1, the foundational mindset. Now, this is probably the most critical part of the entire process. Before we even start asking about symptoms or history, we have to get our own heads in the right space. Getting this perspective right, well, it's the key that unlocks the whole case.
This right here, this is the one. Simple question that should be your guide through this entire process. For just a minute, forget all the complex criteria, forget the diagnostic labels, just keep this one question front and center. It cuts through all the noise and gets you laser focused on what really matters, understanding this person's experience.
And this is the absolute, non-negotiable starting point. The pain, the fatigue, the dizziness, it is all being genuinely felt by your patient. This is never about whether the symptoms are real or imagined. They are 100% real to the person experiencing them. Truly accepting this is the bedrock of any therapeutic alliance.
So here's the core mental shift we all need to make. We've got to move away from that totally unhelpful and frankly invalidating idea that it's all in their head. Instead, we're going to adopt a much more accurate and compassionate view. The brain is simply expressing distress through the body. This one little reframe is absolutely crucial. It'll stop you from making bad formulations, and it really opens the door to helping your patient.
Okay, so now that our mindset is right, let's move on to Section 2, deconstructing the why. To really get to the heart of what's going on, we're going to use 4 deceptively simple questions. Think of them as the core building blocks. You know, if you can explain a problem simply, it means you really truly understand.
These 4 questions right here are the backbone of your formulation. Why this person? That's about predisposing factors. Why now? That's the trigger. Why does it keep going? That's what's perpetuating it. And finally, why this form? As in, why these specific symptoms? Each one is a vital piece of the puzzle.
So, first up, why this particular person? Here we're looking for those long-standing vulnerabilities. You know, things like an anxious temperament from way back, a tendency toward negative thinking, or maybe perfectionistic traits. It could also be a history of health anxiety, or just having a tough time recognizing and naming emotions. Basically, what's in this person's background that makes them susceptible to expressing distress this way?
Next question. Why are the symptoms showing up now? We're on the hunt for a trigger, a precipitating event, a big stressor at work, a loss in the family, or sometimes even a minor medical issue that just didn't get better like it was supposed to. Now here's the key trick. Your patient might not see the connection at all, so you have to be a detective. Look at the timing. What happened in their life right before all this started?
Okay, now we're getting to what is often the most important part of the entire formulation. Why does it continue? This is where we find a nasty, vicious cycle, a self-perpetuating loop. It works like this. Stress creates a bodily sensation. That sensation gets a catastrophic thought attached to it, like this chest pain has to be a heart attack. That thought creates massive anxiety, which, you guessed it, creates more physical sensations, which just seems to confirm the original fear. Clinically, this loop is almost always our main target for intervention.
So what keeps that loop spinning out of control? Well, a few key behaviors add fuel to the fire. Things like being hyper-aware of every little bodily sensation, going for repeated medical tests, constantly seeking reassurance, or avoiding activities out of fear. Each of these things just reinforces that core belief that something is terribly physically wrong, making that vicious cycle spin faster and stronger.
And our final question is a pretty fascinating one. Why this specific symptom? You know, why chest pain instead of headaches? The answer often lies in someone's personal history or their cultural background. For instance, if a parent had a serious heart condition, chest pain becomes a really potent and, in a way, credible vehicle for the brain to express anxiety. The body often chooses a language of symptoms that has deep personal meaning.
So we've figured out the predisposing, precipitating, and perpetuating factors. Now it's time for Section 3, the mind-body bridge. This is where we connect all the dots and explain exactly how psychological stress can turn into very real, very physical symptoms. This is how you can explain it in simple terms. Stress kicks our fight-or-flight system into gear. The brain, now on high alert, starts to amplify normal everyday bodily signals. You know, the gurgles and twinges we usually ignore. Then when you focus all your attention on that signal, it gets louder, kind of like how a ticking clock seems deafening in a quiet room. And finally, the fear that this signal is dangerous is what makes it stick around. It's a direct physiological pathway from the mind to the body.
All right, we've gathered all the pieces of the puzzle. In Section 4, we're going to assemble them into our final product, a single, powerful formulation paragraph that tells the patient's entire story cleanly and clearly.
And this is what it looks like when it all comes together. Think of this template as your North Star. See how it flows? The patient presents with persistent somatic symptoms. Boom, validation. There is a premorbid vulnerability. That's our why this person. Symptoms were precipitated by, that's our why now. And here's the engine of the problem, perpetuated by hypervigilance. It all leads to that elegant summary: psychological distress is being expressed through somatic symptoms. Every single piece of our framework is right there, telling a clear, compassionate, non-blaming story.
And now for our last and maybe the most practice-changing step of all. Formulation first, diagnosis second. This section is all about the proper order of things, and the golden rule is simple. You always figure out the formulation first. Once you have that rich, detailed formulation, once you truly understand the why behind everything, then, and only then, do you look at a list like this and decide which label fits best. These diagnoses are the final step. They're just a shorthand for the rich story you've already uncovered. And this right here is the key principle to take away from all of this. A diagnostic label can be useful, for sure, but it should never, ever replace your deep understanding of the patient's unique story. The formulation is the why, the diagnosis is just the what, and the real therapeutic magic, that lies in understanding the why. So let's wrap this up. We started with one simple question. We made a commitment to believe our patient's reality, and then we systematically deconstructed the why. Following this path can really transform a confusing, frustrating case into a clear, compassionate story. So the only real question left is this: how will this framework change how you approach your very next patient?